JBN, we keep you informed. 4 killed across 3 parishes. 4 people were killed across 3 parishes in a matter of hours yesterday. In Manchester, 31-year-old Michael Booth, otherwise called Den of Greenville District, was shot and killed by unknown assailants about 10:45 a.m. Anton Graham, 18, a chef of Atfield District, and Shona Farquharson, 32, unemployed of Battersea District, were also shot and injured. In St. Anne, about 8:20 p.m., Garfield Cunningham, 19, and Alex Williams, 20, were shot and killed by an unknown assailant in Steertown. And in St. Andrew, about 11:20 p.m., Okina Roden, otherwise called Tommy Lee or Beanie Man, a 26-year-old unemployed man of Bay Farm Road, Kingston 11, was shot and killed by unknown assailants. The police are investigating. No mass release of prisoners if COVID-19 explodes. The Jamaican government will not be releasing low-risk or short-term inmates from correctional and remand centers, even if COVID-19 reaches epidemic proportions. Matthew Samuda, Minister without portfolio in the Ministry of National Security, has said. No, Samuda said yesterday afternoon in responding to queries while on a tour of correctional and remand centers across the metropolitan area to further assess the readiness of the facilities to mitigate the possible spread of the novel coronavirus COVID-19. Iran has temporarily released more than 70,000 prisoners amid the concerns that the novel coronavirus could spread rapidly. COVID-19 deaths there have topped 500 among more than 11,000 infections. Prisoners with sentences longer than 5 years have not been released. Sentences have been waived for some older convicts because that cohort of the global population is potentially at greater risk of infection and death. Samuda said that the National Security Ministry has made preparations for the worst-case scenario. Should the worst visit any of the institutions, we have identified isolation facilities to hold people if there are any initial signs, the minister said. If the signs move beyond that, depending on numbers, they would have to interact with the public health system, where it would transfer them by way of isolation to the public health system. The Horizon Adult Remand Center, the largest such facility in the island, which has a capacity of 1,036, is currently below capacity by some 26%. However, the Tower Street Adult Correctional Center, which should accommodate a maximum of 850 persons, currently houses almost 1,700 inmates. The St. Catherine Adult Correctional Center, which can house 850 persons, is just under capacity. Samuda said that several measures have been put in place to mitigate the introduction of the virus into the prison system. So the first thing that we did, and the DCS made the decision, was to curtail visits as of Monday, March 16. The fact is, COVID won't originate in the facilities unless it's brought in either by staff or by visitors. Visitors we can control, staff we definitely can't, Samuda said. Samuda said that the National Security Ministry was seeking to procure adequate volumes of hand sanitizers, masks, gloves, and cleaning supplies to mitigate the possibility of transmission. He also indicated that temperature scanners were also being sourced. Residents avoid St. Ansby Hospital like the plague. As news spread across St. Anne on Friday that 3 of the 6 persons confirmed as contracting the novel coronavirus were being treated at St. Ansby Regional Hospital, residents of the parish shied away from the institution. On Friday afternoon, just a handful of persons had visited the hospital for attention all day, with the emergency room virtually empty. The Ministry of Health and Wellness announced on Friday that the 6 new cases included 2 men aged 63 and 67 who came into the island from Malaysia by way of Dubai and London on March 7. It was later confirmed that 3 of the patients were being treated at the St. Ansby Regional Hospital, including the 2 from Malaysia. For vendors near the entrance of the hospital and the taxi operators, who usually transport persons from the hospital to St. Ansby, it was business as usual, with no signs of mask being worn. We feel cut up about it. We know it's serious, man, one taxi operator said. Another driver expressed disappointment in the authorities' handling of the emerging COVID-19 cases. It never have to reach a stage. Them never check the ship them and the plane them. And when them see it, they know them start check up. If them that check it from early won't get leak out, lockdown the country can't help, cause it done there already, he said. Both respondents declined revealing their identity. Meanwhile, shoppers continued stocking up on supplies. Pharmacies in Ochiras were completely out of vitamin C tablets, and the supermarket shelves were empty of Lysol, hydrogen peroxide, and other cleaning agents. Tufton warns taxi operators to end discrimination against nurses. Taxi drivers across Jamaica are being warned by Health Minister Dr. Christopher Tufton that the government may confiscate their license if they continue to bar nurses from accessing their services due to the fear that COVID-19 may be transferred to them and other passengers. Though the minister noted that in another day or two, 5 buses will be dedicated to transporting nurses to and from work, he has demanded that taxi operators desist from the practice. Minister Tufton said reports from the Nurses Association of Jamaica, NAJ, or that some taxi operators in Manchester, St. Anne, Trelawney, St. James, Westmoreland, and Kingston have been leaving healthcare workers stranded. If the practice becomes continuous, then we may need to take action. Otherwise, these people run taxis and they need license. If they are actively refusing to carry out essential services to our workers at an important period of time when we need the public health system to be responding, then those who are involved could lose a license if the practice becomes sufficiently widespread, Tufton said yesterday. The minister is assuring the public that nurses take extra precautionary measures when carrying out duties, as their safety and that of patients is paramount. He added that we are looking at the extent to which the respective hospitals can give some support to transporting our nurses to central points. We have solutions in terms of our own programs, but at the same time, taxi drivers should not refuse our nurses access. Bull Bay under wraps, residents anxious to be cleared after 14-day quarantine. There was an eerie calm over 7 miles in Bull Bay, St. Andrew yesterday, as members of the security forces stood guard at key entrance and exit points of the area now under quarantine, as the government ramps up measures to stem the spread of COVID-19. In the community, the evidence of the restricted movement was visible. Hardly any vehicle or persons were allowed in or out of certain areas, particularly Morales Drive, where tight-lipped soldiers and police, some with masks on, guarded with vigilance. Late Friday evening, Prime Minister Andrew Holness declared communities in 7 miles and 8 miles Bull Bay, bordering St. Andrew and St. Thomas, a quarantine zone for 14 days, curtailing movement. Patient Zero, Jamaican, visiting from the UK, arrived in the island on March 4 for the funeral of Gloria Clark 3 days later and was staying in the area. Authorities are now tracking more than 30 people who have had direct and close contact with Patient Zero. With some 8 confirmed cases of severe acute respiratory syndrome, coronavirus 2, at the Health Ministry, now tracking between 200 and 300 persons who may have come in contact with the patients across the parishes of Kingston, St. Andrew, St. Thomas, Clarendon, St. James, and St. Anne. Jamaica has been declared a disaster area under the Disaster Risk Management Act, Declaration of Disaster Area Order 2020. Yesterday, however, Holness sought to clarify his position on his Twitter page, noting that he was not calling Jamaica a disaster area, but was in fact describing COVID-19 as a disaster. In spite of the strict measures in Bull Bay, the needs of the residents were being met, while they are closely monitored for symptoms of the respiratory virus. Along the Bull Bay Main Road, the operation was less restrictive as there was freedom of movement, and many residents continued their usual routines, which included buying and selling. Carlene Simpson, an elderly diabetic of Shooters Hill, which is close by Morales Drive, the area particularly under lockdown, said she was taking no chances with the coronavirus as she regularly disinfects her living space. She revealed, however, that last week she could have been compromised herself, having visited very close to the area where the first confirmed coronavirus case was identified. I work on the road. My cousin tell me say they might give away building materials and I was going to check about it. When I reached near a yard in 7 miles, them say I mustn't go any further because the place terminate. Me said, Jesus Christ, and I didn't push it any further, she said. It's long after I see the lady come out with the mask and me just take on myself. From that, me try keeping at my house. Me hear them say people with diabetes and asthma must be careful. Them say we must wash our hands round the clock as best as possible when we finish what we're doing. Me I try to keep up with what them say and me I beg God to keep me out of it because my sickness can't match with that. Swag, a resident from the Shooters Hill community who was shoveling marl on the road, described the events as a state of paranoia among residents and members of the security forces posted at checkpoints or those patrolling the general Bull Bay area. Police are do different work now. Them not touch nobody. Friday night them pass through. Normally we can't be on the corner, but now them not interact with nobody because them don't even want touch we, he said. People all mask up and the security them no say nothing. Normally you can't pass them mask up. But people can't mask up and pass them now because the security force is paranoid too. To tell you the truth, people strapped down around here. You're lucky enough to come and see me out here like this. Though not scared, Kemar Howell, who lives off the Bull Bay Main Road along the coastline, said he, his wife and 4 children mostly stay inside as a precaution. He said he wasn't worried as there were no local deaths from the virus. My 4 kids are inside and they are not coming out. We don't want them to mix and mingle. My big daughter make sure nobody can come in the house because she don't want anything to happen to the family, he said. JBN, we keep you informed. Please remember, subscribe, like, share, leave us a comment and click the notification bell to receive our daily news items.